Okay, today's tips or hint case, this difficult anatomy with short arch lady, when it is difficult to cannulate the RCA with the regular catheters. And here's the AL75. What makes it even more difficult when the patient is very heavy breather, like this case. Injection through the JR4, you see the shadow of the RCA, which is like almost anterior takeoff. So in this case, I used hockey stick catheter from radial axis, and once you advance it to the right cusp, push it some, you see the osseum of the RCA, which looks like anterior, and you see there is tight lesion in the mid segment, which is the culprit of her complete heart to block and non-STEMI. Since the catheter did not reach the osseum, advance the run through directed toward the vessel, and then once the run through advanced distally, then you can use the guidelineer. Of course, first advance the balloon and then followed by the guidelineer. Once you have the guidelineer in, you can take a picture and now selectively engage the RCA. You see the tight lesion in the mid RCA. Of course, dilated using the 2O balloon. And then now we have flow in the RCA. Following, I opted to shock or use the Shockwave 3.5 in the mid segment and the proximal. Here is the Shockwave in the mid segment, like 6 runs, and then use 2 runs for the proximal lesion. Always before pulling the balloon or the stent balloon, make sure you advance the guidelineer to swallow the balloon and place it in a nice spot with nice room to have a good waveform for the pressure, especially in this case when you have no good support from the guide. Now here is the angiogram after the Shockwave, which is very decent results. Next we'll stent the distal and then proximal. Stent in the distal segment 3.538. The next stent will be in the proximal segment, also 3.5 millimeter stent, high pressure like 15 atmosphere. And here is the final results.